Certification of open meeting law requirements have been met. Adoption of the agenda.
I'll make a motion to adopt.
Okay, and motion by Michelle, second to that?
I'll second.
Second by Jeannie. Okay, all those in favor signify by saying aye.
Aye.
Opposed, same sign.
Aye.
Sally was late coming, yep, okay.
Sally, yeah.
All right,
Okay,
carried.
can we stop for just
All
a second, Mr. Chair?
Oh, Sally's question.
There's another call. Stacy, can you hear them?
I can hear them, and I can hear you as well.
Okay, can you guys hear Stacy?
Yes, we can.
Okay, we're good to go.
Awesome.
Perfect. Great.
All right, motion carried. So we'll go on to the minutes of the last Human Services meeting from August.
I do want to say it's from your August 9th meeting, I believe. You did have a meeting August 23rd. You'll get those minutes at the next meeting. I should have brought them here, but there were two of us doing them, and we needed to coordinate, and somehow that didn't happen, so I apologize for that, but you'll get that at your next meeting.
Any questions of last month's minutes? We've had them to read, so I'm assuming that,
I'll make a motion to approve last month's minutes.
motion by Michelle, second to that?
I'll second.
Karen? Okay, any questions? Discussion? If not, I would look, motion to approve here. Okay. Signify by saying aye.
Aye.
Oppose? Carried. Okay, then we're going to go on to the report and update by agency consultants.
I'll do a brief introduction, if you don't mind, and then
That's
we'll
fine.
have the
That's what we
consultants
need.
speak.
That's what we need.
So we've talked about Stacy and Nicole being the consultants, and so we're kind of starting to get into the work of what they're going to do now. Nicole Millerin is in the room, and if you want to come on up to the podium, she'll speak in just a moment. I have given you 3 handouts for this conversation. The first the first two are proposals that we received from Stacy Shapiro, Shapiro Strategies, and Nicole Millerin through Brave Spaces. And so those you have in front of you just as a idea of what they're doing. And then Nicole's going to walk a little bit through what she's doing, as is Stacy, who's on the phone. The main difference between the two of them are these two women have not worked together before, but pieces are really coming together very nicely. The main purpose of what Shapiro Solutions is going to help us with is really helping with resetting our agency culture. And the piece that Brave Spaces and Nicole's going to work with us is really building the staff resiliency, really helping heal the relationships. As Nicole has pointed out to us before, that there was clearly a fracture that caused this, that existed long before the 15th of June, and so how do we move past that? Both of them have kind of a 6-month plan that they will talk about shortly with you, but because this isn't going to happen overnight. But I'm excited. I think we're going to end up in a much better place than we have ever been as an organization, and I couldn't be happier to work with such talented individuals. Dorjean and Diane, I'll get you copies of your stuff here in just a second. And I think that's all I have for introductions. And so, do you want to go first, Nicole?
It's actually Stacy.
Oh, Stacy's going to go first. Okay.
Sounds good. Thank you so much, Deb. And good afternoon, everyone. I look forward to meeting you in person sooner than later, that's for sure. Can everybody hear me okay
Yes.
before I keep going? I hope so. Wonderful. Again, I'm Stacy Shapiro. Deb talked about a little bit my business is Shapiro Strategies, and I was lucky to meet Deb many years ago when I was the executive director of Big Brothers Big Sisters in the Cooley region, and she was the executive director at Family Resources at the time. both in lacrosse, and our paths crossed often at that time. And since then, I've owned my own training and consulting business, and I do work directly with businesses, organizations, nonprofits, all the above to help improve agency culture. And I do that in a variety of ways. And I try to learn a lot about the organization that I'm working with and just target my work to match their needs. And I do love what I do. I've connected with Deb
has joined the meeting.
Okay.
Just keep going.
I've connected with Deb several times. Let me know when you're ready. Okay.
Keep going, Stacy.
So I've connected. Okay, you bet. I've connected with Deb several times in the last several weeks, and I'm really eager to work with her and the Human Services staff. And as you have seen or are looking at in my proposal right now, I've been hired to assist in just helping your department move forward in a healthy manner. And both Nicole and I have much the same vision, and our work will consist of a combination of surveys, trainings, consulting over the next several months. And my personal focus will be on really helping to strengthen that agency culture, re-strengthen, I should even say. And I'll work closely with Deb, and I'll meet with Erica as well and work with the staff through targeted trainings. And I just believe that everyone has a role to play in strengthening a work culture, and so I'm eager to get everyone on board with that. And so with that, that's my piece, and I'd love to turn it over to Nicole to share more with you about her work and her plans. Nicole?
All right, thank you. So as Stacy said, she and I are going to be working collaboratively. So just a little bit about, for those of you who don't know me, so I spent 23 years at La Crosse County Human Services, so I think that's important in terms of understanding culture and understanding kind of the inner workings of a human services agency. And then I left and went into private practice. So in working collaboratively with Stacy, to really address the agency culture, but also the relationship cultures. And with my work with agencies, whether it's human service agencies or school systems, there's different threads that are woven together to create Trempealeau County. And at this time, it appears as if some of those threads have been frayed or fractured. So really the intent is to, how do you strengthen those? How do you repair those? And that, in my belief, has to be a multidimensional approach. And so really it's about the sections coming together, the units coming together, and the people. So all of that might sound daunting, it might sound big, but it's there regardless. I mean, you guys will continue whether or not we're doing this work. And so when you think about implementing this work, we have a plan. Both Stacy and I will be coming in monthly, and then interspersed with those monthly trainings, we'll also be working collaboratively with the supervisors and the staff, both understanding both the culture and the relationships, but how do we also teach a different level of repair and rebuilding? So it's the understanding, it's the teaching, and it's also doing the work. But more importantly, even from that, is how do we create a sustainability plan? Because there's going to be time and energy and actually money connected to this. And coming from human services for 23 years, I know that we went over many things, and sometimes those would be lost 2 or 3 years later. And to be fiscally responsible, I would love to see a really strong sustainability plan so that the efforts that are put forward right now will continue. Because some of the people even in this room might be gone, right? But yet your human service agency won't be. And so it's really not about person-specific always, but it's about culture-specific. It's about agency-specific, and how do you create a really, really strong agency. The other thing I'd like to invite the Human Services Board, the County Board, your HR department, your Corporation Council, I would like to see all of them come to one of my one-days, because I think that you guys are those threads. So I don't know a lot of you, but I'd love for you guys, and I know time is a very precious commodity, but I also think that it's really vital that you guys are there. So there will be 2 one-day trainings that I'd like to invite you guys to. And I think that that will be both a key component to strengthening the relationships with everyone, but it also gives a pretty strong message to the commitment that you guys all have already. So I really appreciate the opportunity, and I'm really looking forward to working with everybody. Thank you.
I'm thinking that you have questions, thoughts, ideas for both of Stacy and Nicole, kind of wondering where this is going or things we might be considering or we should consider. I'm wondering if you have any of those you'd like to share at this time?
And sometimes they might not know the questions to ask. And so as we get going, you'll see me and hear from both Stacy and I once a month. And so it might be more clear the questions as we get into the depths of things and as you get a sense of really what this looks like, because it might be kind of untouchable and hard to really grasp what this is going to look like. But we will be presenting once a month so that you guys get a clear understanding. And I think clear understanding is going to be key so that we know what we're all on the same page moving forward.
I have a question, Kurt. This
Go
pre-survey,
ahead,
that's
Michelle.
September 15th, a couple days from now. How are you planning to do that pre-survey for all staff and sections of the agency? Are you going to come here?
Yeah, very good question. So I'm creating a Survey Monkey. So it will come from me, but I want it to be completely anonymous because I really want people to feel safe in what their answers. So it'll be sent from me and it'll come back to me. So it'll be completely anonymous and it'll be the same questions at the beginning of our work and the end of our work. So thank you. That was a good question.
Are you
And
going to
I would just like to add that, can you hear
I
me?
was just going to say, can you send it to our committee member? I mean, do we have to?
I'm thinking, Nicole?
Yeah.
Certainly, we can do that.
Absolutely. And I was just going to say, we are going to use that information to inform our work as we're creating our trainings, as we're using, so to know what the issues and the challenges are, because everything is sort of tailored to that. So that'll be important information.
Okay.
Jeannie?
Nicole, you have dates here, are these the dates that you would, like, early October, October 14th, December 9th? Are those the times that you would want committee members to attend?
Yeah, so
Okay.
there's two choices, either October 14th or December 9th.
Okay.
So we know that throwing out one date wouldn't capture everyone's availability.
Okay, so it's the 14th or the 9th?
Yep, so
One of
they're
those
the
times.
same.
Okay,
Yeah, good
just
question.
let you know, or we just show up?
Yeah, I think we'll kind of figure out how to do a sign-up, a
Okay.
registration, so we
Okay.
know, yeah.
right,
Because
thank
I'm
you.
sure everyone's got to track, that one of their staff is signed up for one.
Okay, thanks.
Yeah. I would love it if you were there. Yes, I strongly encourage that you guys are there.
Are they both going to be the same? I mean, like, we should do one or the other? or should
Yes, so they are the
Okay.
same, yep.
we- All right.
But then the third one that I do in February 15th, that will be different, and that's the one that I want everyone to attend as well.
And each of Stacy's trainings will be different. So Nicole's will be pick one day or the other. Hers are full days. Stacy's trainings are each half days. Again, we're scheduling some of them out in October, November, and in January, but those will each be separate trainings.
Any other questions?
You will be hearing, we will have an agenda item at each meeting between now and March with updates of what's going on with the consultants, so you can kind of see the progress that we're making as an agency and really provide some direction and input on how we're moving forward as a department. So. Okay, thank you. Thanks for coming up here. Thank you, Stacy.
Yep, thank you, Stacy.
Thank you very much. Hope to meet you all very soon. Take care.
Thanks.
Okay. We'll move on to number 6, economic support.
Stacy has left the meeting.
We'll move on to
Yep.
number 6,
Okay.
economic
Sure.
support program presentation.
So Sandy Pilkowski, wave so they know who you are, and Dana Lee, our supervisors in our Economic Support Department, or unit. Again, as I've mentioned before, we are the only county outside of La Crosse County in our 8-county consortium that has more than one supervisor. Some counties don't even have any supervisors, so it speaks to the talent that we have here in our staff. So Sandy and Dana are going to talk to you about some updates on what's going on in economic support these days, and they asked to be on the agenda, so I'll let you guys go.
All right, thank you. So one of the pieces that we wanted to cover with the board today was the Western Region for Economic Assistance just recently received our results from the annual management evaluation review. So just a little bit of background about this review. It's the Administration of Food Share. FNS does the review with the state to determine federally, how our food share program is being managed and run. So the objectives of this review are to provide a systematic method of monitoring and assessing the food share program administration in project areas, provide a basis for project areas to improve and strengthen program operations by identifying and correcting deficiencies, and provide a continuing flow of information between income maintenance agencies, state agencies,
Has left the meeting.
and the food and nutrition services necessary to develop the solutions to problems in program policy and procedures. So some of the assessment tools that were used: active and case and procedure error rates, their CAPER rates, application, certification, case file reviews, customer call reviews, case sample reviews of the EBT card utilization, lobby observation and website reviews, review of annual mandatory training, and customer advocate and staff surveys. So one of the pieces that we had was accuracy and benefit issuance. So the national standard payment error rate was 6.0% for federal year 2020. Wisconsin's average payment error rate for that same period was 7.32%. And our Western Region's error rate for that same time period was 5.54%. So we beat the state average.
You do that every year.
We try.
You do, don't you? Yes.
Possibly.
Yes.
So application and certification case review results, 25 cases were randomly selected for the food share certification confirmed period from October of 2020 through January of 2021. And the summary was no errors were found. All 25 cases which were reviewed for accuracy at certification were found to be correct. The part of the food share quality control reviews. So we have, our consortium has implemented its own internal quality control for the financial review of cases. We started this targeted case review process last summer. It's a pretty intense project, time consuming, but the results of our correct cases paid off in this review. So every time a staff member confirms food share benefits within our consortium, they are tracking those cases, they send them in, and then either lead workers or supervisors are pulling a random sample throughout the month to QC those cases. Weekly statistics are sent out to supervisors who are then going over those with their team members. We have benchmarks, so if a current staff who's not in the full project falls below 75% accuracy, we have steps in place, things that we implement, coaching, different plans. If they continue, then we would put them back in the full QC project. A new staff person who comes through training in transitions to one of the teams is expected to be at 85% for a pretty lengthy time period. Once this happens, they can drop to the lesser QC rate. So this project, as time consuming as it is, has been one of the keys that has led to the success with this current state review. All right, Dana.
All right, I think we finally got the PowerPoint up and going to follow along here. So, all right, so this slide is kind of showing us the results of the customer service survey. So 95% of our customers said that agency staff treat them with respect, and actually that was 97% feel they're treated with respect, and 95% feel that agency staff are helpful. There might have been some neutral in there because I don't think the numbers quite add up. There's 1% that might not be in there, but so that overall shows that, our staff are doing a wonderful job communicating with customers. They're providing excellent customer service. To have 95 to 97% of our customers satisfied is pretty darn good. So we'll go to the next slide. Here were some of the comments that were shared in the customers' surveys. This is greatly appreciated. The results from Proper Food Share have shown on my labs drawn last week. A very big positive change for me. Thank you. I am currently disabled and undergoing treatment for cancer. I cannot say thank you enough for all the help that I've received. Thank you. I'm retired and over 70 years old and partially disabled. I can't imagine how hard it would be for me to survive without Food Share. Thank you. I'm very thankful for it. It's a lifesaver for me right now. It's keeping me fed and healthy, and I don't know what I'd be doing if I didn't have it. Thank you, guys. Thank you for all the extra help we have received during the COVID pandemic. It's helped us so much. Again, thank you very much. Food Share saved us from only eating once a day. I was treated with kindness and respect when speaking with a representative on the phone. I truly appreciate the benefit, and it has helped a great deal. And I'm grateful for this service. It's helped so much, even with a good job. I'm struggling, and without this service, I don't know what I would do. So those are some pretty powerful comments from our customers. We also did a survey with our advocates, our community partners that we work with, and 100% of the advocates said they were satisfied with RIA's service. So RIA is always responsive, professional, and customer focused, and we're a great partner and resource with our community partners. And to kind of give a summary of the best practices that were observed over the past year, basically our customer and advocate surveys are a great reflection of the extreme professional, helpful, and courteous services that we perform. Sandy talked a little bit about our error rates. The Food Share certification tool showed no errors were found, which suggests that our staff are very knowledgeable in certifying Food Share benefits, and we continue on with those same practices going forward. Our active payment error rates were below the state Wisconsin active payment error rate average. And our EBT card report shows that we continue to kind of be a model for the state of Wisconsin with a focus on program integrity through the vault card replacement process. We've kind of been a leader in how we have issued Food Share EBT replacement cards and other consortium in the state. There's a process, kind of a checklist that we go through to kind of ensure that people aren't abusing the program, yet those that really need it are able to obtain the card. So we kind of developed a little process checklist that we use to help determine the need and go from there. So
I think one of the pieces too with the advocate survey, when we first formed the consortium, that was not the same result, those survey results. There was quite a few hiccups along that, developing that process and really building that trust with our partners. And counting on us as far as the new model.
Mm-hmm. All right, so just a summary. Obviously, we had a really great management evaluation review. Very few corrective actions or recommendations were made. The result shows us that our staff are very knowledgeable of policy, professional, helpful, and courteous. Our lobby observations and case reviews went well, and despite all the challenges that we faced in the public health emergency, we continued to be resilient in accurate case processing and providing excellent customer service.
And as we look forward to our review next year in 2021, we're continuing to look at new and innovative ideas and ways to reach our customers through the COVID pandemic. We're continuing our training and support for all of our agents and staff members. We're working on different ways to do community outreach, to get out in the community to those individuals that need our assistance. And as we look at staff returning to the office, and we're looking at, I mean, obviously, we've been doing this for a little while now, but face-to-face appointments for those that have requested them in office. And we also continue to be a leader in the state of Wisconsin through excellence in customer service, accuracy, and program integrity. So it was a really great review. We wanted to share kind of the feedback from it with everybody, just to let you know our ES staff are working hard and they're doing a really nice job.
Yeah. We have a couple of,
I think Daryl's going to pull it up
he's
for us.
going to change over a couple of spreadsheets to share, just kind of showing some of the trends that we're seeing this year with our numbers and recipients and where things are going, and then maybe a few changes that we may be seeing as the year progresses. So Daryl's got that pulled up.
Did you notice any like really big changes in the last 18 months related to the pandemic?
Well, so what we haven't, any person that has received health care, we're not able to close if they were open back in March of 2020. So that piece is still in place. I think one of the concerns that we're worried about is when that ends, how many of those individuals is that going to affect? And it could be a significant number across the 8 counties, well, across the state of Wisconsin, too. So that's one piece that, and we don't know, we don't have that data yet. They're still carrying, healthcare renewals are still being pushed out to like January and February of 22.
Okay.
So more to come on that.
And just, can I just mention, keeping in mind that could affect our participants
Yep.
who are enrolled in programming and have to be MA eligible to be enrolled. So it's going to have a big trickle potential mess that it's just going to be a lot of figuring out people that haven't had to do their renewals for 2 years, and then they have to, and they could be ineligible then, and then figuring all those pieces out and trying not to pull the rug out from under people. So I think that's just,
But there's like no clear timeline on when
no.
that would either be extended or end.
Right, and kind of makes you wonder with the trend now, will it be extended even
That's
further?
what I would hope, maybe.
Yeah, right. Interesting now. So here's a little bit of data. So this kind of shows us,
That's Putnam County.
yep,
I can't change it.
you can't, there's RIA total, all 8 counties. So when we started the year, we had 60,921 recipients open for the healthcare food share programs, broken down by 31,243 healthcare only, and then healthcare food share combined, 25,910. We issued $6,427,015 in food share benefits in January. And then the RIA subsidy, which is the child care assistance, was $269,670 across the 8 counties. Now, if we drop down to August, you can see that we have had an increase in recipients. We're at 64,553 total recipients, so we've grown. Healthcare only 33,443, and then the healthcare with food shares 27,024. Issuing $7,338,057.98. Now, we've seen an increase in those issuance because we've had those emergency allotments. We've had the max allotment increase of 15%. There's been kind of a variety of pieces that the state has done during this health pandemic. And then you can see, if we look at that Wisconsin, the subsidy dollars, so if you look at June's, we issued $382,000 subsidy across the 8 counties, and now it dropped in August to $297,681. Part of that is they ran with the Wisconsin Shares program. They did a 21% increase in those households' benefits for anyone who had children 3 and under. And that ended the end of June, so we're starting to see a little less in that subsidy column. Now, if we look at just Trempealeau County, Daryl's got it. So if we start at the beginning of the year, we're gonna see that same trend with our Trempealeau County numbers. And we had 6,275 recipients in the county total and 6,715 for, Trempealeau County. So we're seeing that same slight increase in our data. We issued $653,875.80 in food share just in Trempealeau County for the month of August. So those are all dollars that are coming back to those local merchants that accept our Wisconsin EBT card for those food share benefits. And the same notice in the subsidy dollars, the decrease, and that too has to do with that 21% increase going away the end of June.
Daryl, can I have you go to the CCA tab next, please? All right, so this is just a summary of information on our call center anywhere statistics, or number of inbound calls that are made in our call center. As you can see, the beginning of the year through probably, I would say July, we've kind of remained consistent between 5,000 to 6,000 calls being offered or answered. We did see an increase of number of calls in the month of August. We had 7,721 calls offered to our call center, and 7,614 of those calls were answered. Our average speed of answer, it's taken us a little bit longer. As you can see, back in January, we were answering calls pretty quickly, and now we're probably at 1.74 minutes to answer. Our talk time, the time that we spend with the customer on the phone, that's 10 minutes, and our average handle time, which might include some time on hold with the customers, is 10.6 minutes. So you can see that increased over the course of the last month. One of the things that has come back into play for us and what's increasing the calls is through the COVID pandemic, a temporary policy was in place where customers weren't required to provide verification. We were able to use their word as kind of best available information unless it was found to be questionable. They brought back the verification requirements again, so now we're having to pen cases and request that verification to be coming from the customers. And also, looking at the month of August, we do have 4 vacancies across the consortium currently that we're awaiting to fill. So we have, had some vacancies across the board, but now we're starting to see workload pick up. We're hoping to get those vacancies filled as soon as possible. One other thing that has happened, it probably happened earlier, maybe in May or June, I don't recall the exact date, but we did bring food share renewals back in. So while customers aren't required to complete their healthcare renewals right now, they are required to do food share. They aren't required to hold an interview. That's still being waived as a temporary process, but they are still required to complete their renewal.
It's so interesting for childcare. They went away from a lot of the temporary processes last summer already. So we're doing, they have to do an interview for the child care application renewal. We were able to use that best available code for those verifications up through July, but that has definitely increased the workload with documents coming in, calls with questions and whatnot for our agents. Any questions on any of this data for either of us?
Great work. And you're busy.
Mm-hmm.
We are.
It's picking up. I had a gal out for a week last week, and she came back today, and she's like, oh my gosh. She's like, you said this was going to start happening. And I'm like, mm-hmm.
Yeah.
We're back.
No, really good work. Great. Thank you all.
Thank you.
Thank you, Sandy. You guys do phenomenal work and appreciate all of it. So thank you. Thank you.
Okay. We'll go on to number 7, grant applications.
So technically, we need to get your approval to apply for grants, and there's two of them that we're working on right now. One is the TAD grant, which is Treatment Alternatives and Diversion. That's a five-year cycle. So we applied in 2013. At that point, it was a 3-year funding cycle, so we were funded for 14, 15, and 16. Then in 16, we applied for a 5-year cycle. That's what it was then. So it was 17, 18, 19, 20, and 21. So we're on our last year. So now it's a competitive application, and this is for our recovery court. And so we'll be sending in an application. It's due next week. It'll be around $100,000 application, and then we would get that each year. The other one is the Youth Diversion, and Erica, if you just want to give a couple words about what that's about. That grant is around $135,000.
Yeah, so every year we were awarded the grant for 5 years. So last year, 2020, I can't remember what year it is, was the first grant cycle. 2021, we're in year 2. And so now we're working on the work plan and budget request for 2022. So every year we do have to do our request, and we also have to fill out performance reports to show that we're meeting the requirements and expectations of the grant. So the performance report I submitted in early August, and I'm currently working on the 2022 work plan and budget. So that will be going in hopefully within the next week or 2 at the most.
So, yeah,
Michelle?
What's the TAD stand for, treatment?
Treatment Alternatives and Diversion. The DA's office is also going to be applying under that same fund source for a diversion program that they're taking over. And we're having internal discussions if we should combine the application or do separate applications. There's pros and cons to both. And so we just want to make sure we make the right decision before that goes in. So that's what that stands for. So we would need your approval then to submit both of these applications. Diane, did you want a cookie? We have some here we can pass down to you. Okay. Oh, okay. So make sure you're fed and watered, okay? So.
Okay. We need a motion to approve the grant application. Karen? And Dora, you seconded? Okay. You have that, Sam? Okay. All those in favor signify by saying aye.
Aye.
Opposed, same sign. Okay, carried. Discuss and approve COVID safety practice.
So we have a COVID policy on visits and all that sort of thing, which was created prior to vaccinations. And so the numbers in our county are going up. We were told at our internal COVID meeting last week, Sally's the chair of that group, that we are in the red zone in terms of transmission in Trempealeau County, probably all around the area. And so we want to make sure that we keep the people we serve safe. We want to keep our staff safe. Many of our staff, although not all, have been vaccinated. We had the opportunity to get vaccinated pretty early on. Many thanks to the health department for making that happen. So with your approval, I'm going to be asking staff, let me back up. And Sally, correct me what I got wrong, because I had a missed part of the meeting last week. So there was a lively discussion about masking in the building. It was decided at that time that there would be no change in policy. However, departments could make their own policies based on what they need, based on the work they do. Each department does a little bit different kind of work here. So what I'm going to be asking with your approval or with any input you have from you is that Human Services staff starting tomorrow, when they're in any common areas or in any shared office areas, that they would be wearing masks. We ask that people continue to, when they meet with clients, to work on keeping the distance, the 6-foot distance, the social distancing, sanitizing any spaces. I ask that when you're done tonight, those little yellow packets in front of you, if you want to sanitize the area where you sat, I'd appreciate that. So any areas that we use that are common, that we'd be sanitizing those. When appropriate, to meet with our clients outside, we would encourage clients to wear masks. However, we can't force them to, and it wouldn't be appropriate to do that. And when appropriate, we would be looking at maybe having some more of our staff doing remote work. We just kind of all came back, and we kind of all just got used to being back, and so doing remote is actually, some people who enjoyed it before kind of like, I just like being back in the office now, but partially because of the parking situation too, we're looking at remote work. So as appropriate, we'll be looking at remote work. In the administrative area, we have 4 staff, but we're down to 2, Sam and Mary Anderson. And so we will, I talked with them today, and what we're going to be setting up in that area is, because they sit basically across the desk from each other, is we're going to be putting in dividers to kind of divide the space. And then whoever's doing the windows and the phone, we're going to have a space set up right by the window, so they'll be there. So the other person will be in their office, they'll be a little bit away, because that's a common area where people come in to use the conference room. People come in to, we're going to probably move where the keys for the car are, again, just to reduce the number of people in and out of that area. People drop off the mail there, get their supplies there. There's a nice copier that works faster than anywhere else. I didn't realize how fast it worked till I started using the other copiers. And so it's just a common area. So we're going to be putting in those walls. And again, the person that's up at the front that will be near the staff, they will have to have the mask available as well. So we're looking at ways that we can mitigate this. When we meet with clients, we're going to encourage people to use the conference room space. I moved my office, so everybody knew where my office was right off of admin in the past. Temporarily, I was by the Children and Families Unit this summer. I'm now where our conference room was. It's a nice size room, about the same size as the other office was. It doesn't have any windows. But the nice thing is we've now made my old office by admin, the conference room. It has a window, and it just makes a lot nicer meeting space for meeting with clients. Oftentimes you go there when we're having some hard discussions with clients, and having a little natural light just kind of helps calm people down. Also, if it is a difficult meeting, there's staff right outside that can hear if there is any kind of disruption in the room, so they can, assist in any way that's needed. So I think, in fact, every staff person has said, why didn't we think of doing this sooner? So that's been a real positive thing. But we have a plexiglass in there, so clients will sit on one side of the table, staff on the other. We'll have the sanitizing wipes for that as well. Curious if you have any other thoughts, recommendations. Again, we have been vaccinated, but that, even with this Delta variant, doesn't protect you 100%. So we don't want to be negligent, but we also don't want to be overly cautious. That makes people, the clients we serve, uncomfortable. So I don't know if you have any thoughts or input. Or Sally, if I missed anything from Friday's meeting that's important to mention.
Well, I think what's important to mention is that the health department has had a policy for, close to a month, if not more than a month, where anybody into the health department has to wear a mask. Staff, any visitors to the health department, or even staff while they're out doing the work of the health department. The conversation, as Deb said, was definitely lively, and it was what's happening all over America. It was certainly not unique to us. One thing that we did talk about, maybe a little bit more after you had to leave, Deb, was that mask is just one of several layers of mitigation that we have to look at. And so that, as you described with the policies, that pretty much addresses a lot of it. Sanitation, social distancing where possible. We can't control what the public does when they come into the courthouse right now at this point, where we don't have a mask requirement for county facilities, but we can control the amount of exposure that our staff and our operations have. It's vital that we continue the operations of the government, the operations of the system. All our departments are departments that have, and that's across the county, where we only have a few people doing many things. We have some departments with only 3 or 4 people. All it takes is one person getting sick and having a breakthrough, and we could have a department get shut down. And so we definitely need to be as proactive as we can, while still making sure that people are as comfortable as they can be while they are doing their jobs. So this is as much about protecting the continuity of government, the continuity of the service that we provide, and also to protect the employees who are required by the nature of their jobs to interact with people whose, wellness is not necessarily something that they are going to know or going to be able to ask about. And so the numbers have been alarming, and I think that being very proactive in this is how we're going to get through what is, who knows where this variant or the one after it's going to take us. So having a good solid policy in advance gets us ahead of, I'd much rather we be proactive than reactive. We've had a year or something of being reactive. We need to be in a proactive position, and this is very proactive.
I have a question for Sally.
Go ahead, Jenny.
Sally, I have a question, and maybe you don't know this, but I'm guessing you do. Is the health department tracking the new cases, if they're breakthrough cases or non-vaccinated people?
I do not know that off the top of my head. I think some of those are questions that probably are best directed to Aaron.
Okay.
But I mean, he's certainly, Jeannie, give him a call. Anybody
yeah.
should, because he definitely has a tremendous amount of experience, and he's very proactive in how he's doing
Okay,
things. So,
I'm just curious.
yeah.
on the state website.
Oh, it is? Okay.
So I can't remember if it's on the DA.
I will say this one thing. He has made the offer to meet with department heads to kind of do an overview and see, kind of customizing as they figure out their policy. And I think Deb had some conversations. She's got questions. She's definitely, like I said, been very proactive on this. And so, yeah. But yeah, give him a call, because he knows his stuff.
It's either on DHS or it's on the lab.
Okay.
State lab site, one or the other, and it's got it set up as like a dot matrix.
Okay.
And it'll show you how
Okay.
many breakthroughs and how many.
Yeah, the breakthroughs are real. My daughter and her partner and their 2-year-old all have COVID right now. And the adults have been vaccinated. The baby, of course, wasn't, and probably got it at his Montessori school. So
Sorry to hear that.
yeah, and she's actually pretty sick, but so it is real.
Okay, so,
So I'll be sending out a memo this evening to staff and let them know what our expectations are. Sam, you guys have to wear masks till we get your barriers put up, so we're trying to make it a little bit more manageable for everybody, but we want to be smart, so.
And I think your what you've laid out here is good, sound, safe. I mean, the key is to keep our staff safe and not, I don't know if I could live through another shutdown, everything just going crazy. So the more proactive and the better we take care of ourselves, the better we'll all be.
so did you want a motion on that? to
Nope,
approve
I
it?
just wanted to get input
Okay.
on that.
Okay, fine. Well, then we'll move on to discuss the unit reorganization proposal.
Sure. So, Wayne Opitchka, our Justice Services Supervisor, resigned last month, and his last day was actually last week. So I'm going to give you an org chart, because we wanted to talk a little bit about how this could affect us. If you want to actually bring this down. Sure. I'll give this to Jeannie.
Thank you.
So on this org chart, you'll see, yourself as the Human Services Board and the County Board, and
We got an extra if anybody's.
yeah. You want to hand it to Nicole, she could use it. So you will see we have the ADRC, and if you count under there, she has 10 regular staff and then some part-time staff. Under the Children and Family, I'm going to share with you, Kurt, because I didn't keep a copy for myself over there. Children and Families Unit, they've got 11 staff. Behavioral Health, there's 11 staff. Justice Unit has 3. And then economic support only has 7 with 2 supervisors, but those 2 supervisors travel to other counties, and they also supervise staff in not just the counties they travel to, but on their team. So they supervise staff in La Crosse and Clark and all over the place. And then we have our fiscal support, who has, which is a vacancy right now, where there's 3 administrative staff. So I don't have a proposal for you today, but what is very glaring to us is that we have ADRC, Children and Families Unit, and Behavioral Health with way too many staff to support. A good span of control is about 8, as far as you want to go. So 10 and 11 is stretching it. And then you have 1 social work supervisor with 3. So what we're thinking about is, because besides doing no wrong door and working with consultants, we thought we'd reorganize too, to add a little bit of spice to our lives. But it makes some sense to really think about, this is an opportunity to really think about how could we reorganize better. When we created the Justice Unit, it made perfect sense at the time, but as things go and programs grow and things change, and we've added several staff since all that. So it's time to step back and rethink. So I don't have a proposal for you today. The unit supervisors and I kind of all generally agree this is a good idea. But then specifically what changes, we don't know exactly. We know that in the ADRC, there's a few things. For example, one option, we could move the supervision of the administrative staff there to the fiscal unit or the administrative unit, so then they would supervise all front desk staff. It makes sense when they're across the street, but in a year or 2, they'll be back over here, so that makes some sense that might be an idea. Adult protection is not something that has to be done in an ADRC. That might be something we could move. So that's kind of where we could move. And then behavioral health really serves kids and adults, and so we could really break that into an adult services, maybe add on adult protection. Again, these are all possibilities. There's nothing firmed up at this point. And then we have, for children, we have child welfare, we have child protection, we have birth to 3, CLTS, CCS. We have lots of services for kids with disabilities. So we're kind of talking about how do we break that into a couple units. So we might have the ADRC, then we have adult services. I don't know exactly what you call that. We'd move perhaps the recovery court case manager into that adult services. And then in children, we might have kind of the intake part of what we do, there's that investigation intake piece of what we do, and then the ongoing piece of what we do, and merge that with some of the disability services. The challenge is that however you slice it up, somebody still ends up with a little bit too much, and somebody ends up with not as much. It isn't quite as low as 3, but it's not. So we're still working on figuring out those pieces. I think we generally agree to what those groups could look like, but exactly where those dividing lines are and which staff move, we haven't made any decisions. But before we go down this road too far, because again, there's we're trying to create healing and resiliency in staff, and then we're going to switch supervisors. Ta-da! So we want to do this in a thoughtful manner of how we go about this. So before we go too far down this road, we wanted to talk to you about your thoughts on this and any recommendations you have, or if this is something you as a board even want us to do. Erica, is there anything I missed? Okay.
I don't think so.
Okay. So I'm open to any input.
Okay. Well, my personal opinion is I think you all have to do what's best for your department and for each unit supervisor and what works. And we would just go, yay, good idea. I think that gets us too much into the day-to-day runnings of how you organize the department, but I think it makes sense to do some reorganizing, but what you have to do, you and the supervisors have to figure out what is going to work best for you.
Again, we probably would have brought the proposal to you. I know we're going to have to talk to HR about how we do this. We just wanted to kind of get your general thoughts. Is this something that sounds good or something you don't want us to do? in all practicality, we're operating in a little bit of a gray area, because if staff aren't happy, you're going to be hearing about it, and I don't want my career on the line. So, and I'm not trying to over dramatize that, but I just want to be sensitive to, I mean, this whole process has taught me we need to really be sensitive to what people's concerns are, and I want to be thoughtful about that. So before I go ahead, I wanted to make sure this is something you're okay with, something that if you have any thoughts or ideas, I'd love to hear them. The whole management team would love to hear them. So that's really why this is brought forward to you.
You know, when you were talking, before you even said, you know, concerned about people complaining, I was thinking to myself, if this is something that needs to be done, I would think now is the time to do it. We've already got folks who are, you know, there's some uneasiness here and there. And as you got your specialists to work with you and you guys are working through all this other stuff, I feel like this is a good time to work through it all. You know, if there's going to be any ruffled feathers or concerns that come out of it, now's a good time, because I think you'll be at a place where people are going to share what they got going on. And I don't know. I think now's a good time, and I think it's definitely looks to me like it could use a fresh look.
Yeah, I think one supervisor having 3 people, when, Erica, you have like 12, how many?
11.
11?
Right now.
11, and the children's supervisor has 11, and, you know, ADRC is all over the place, but that's kind of what the ADRC is, you know, benefit specialist. But I do like the idea of maybe pulling, adult protection out of the ADRC and moving it somewhere else. I don't know where, but I mean, I have always felt uncomfortable with that being part of the ADRC. I don't know why I feel that way, but, you know, but I mean, I think it's a good idea to do this now. Now is like, you have support, Nicole, I mean, how many times do counties reorganize? Like, you know, it's like the pendulum goes back and forth. So you have good people to help you make these decisions.
Sally, did you have something to add?
Yeah, I do. I would agree with everything said. I have never quite understood Adult Protective Services being an ADRC either. That's always felt awkward to me as well. Like it just, I don't know, resource versus investigation. So they feel like 2 different purposes and missions. But yeah, I think this is a good idea. And yes, change is hard, you know. Anybody that's ever been through it in an organization knows it can be really challenging. But the fact that you acknowledge it's going to be hard for people, it's going to be unsettling, is really a big part of getting through it. So.
The other thing you can think about as you do it is, like when you were mentioning moving like all your administrative staff under one person, you know, that might create an opportunity for some better backup systems. You know, if they were all working under the same supervisor, you might create a capacity that you don't have now.
Go for it.
Thank you, thank you. It's easier to roll out to staff when we say that the board is behind this. I think that kind of gives it some credence. So, Nicole, did you have anything you wanted to add about this? I see you shaking your head a lot, and you've lived through probably numerous of these, so I don't know if you have anything.
I think in the 23 years.
Do you want to go to the microphone? Sorry.
You can just sit at the table.
Yeah, I believe in the 23 years I was in La Crosse, we probably had 3 reorganizations. So, you know, seeing the ins and outs, and I agree, the ability to talk about what that change does for people, because ultimately we know that there's going to be a lot of change, and the impact on people is really what either hurts or helps. So I think that, again, I agree, you know, we're working on the relationships and we're working on understanding. Now's the time to have those crucial conversations.
Great. That's great news. Thank you.
Thank you. Okay, that take care of that one? And we'll go on to number 10, approve non-lapsing account for ADRC donations.
So Melissa Youngbauer mentioned this at a previous meeting, but we wanted to kind of make this more official on how we handle these funds. So earlier this summer, we received an unexpected donation from the Roman Shabilla estate of $10,000 for Trempealeau County Trempealeau County Meals on Wheels, and another 10,000 designated to senior services. That's as much description as we've been provided. At this point, because we were able to get some additional COVID money and some other things, we're doing okay at this point, and so what we'd like to do is put these funds in a non-lapsing account, which means that they will stay there until we use them. And the ADRC advisory is going to be meeting next month, and they'll be talking more about that, about how we'd want to use these. We don't need the funds right now, but we will need them in the future, as we know federal funding and the state funding for those programs keep shrinking and the population is growing. So we know the need is there. We just don't need it today. We want to put it in a safe place so we can account to family members and to the public of how we've used those donations. And so we'd be looking for a motion to set that in a non-lapsing account, and I'd be glad to answer any questions you have.
I'd make a motion to set that $10,000 into a non-lapsing account.
Okay, Jeannie made the motion, second? Second?
Second.
Second by Karen.
We just told mine.
Okay.
Anybody else to put their hands up?
Any discussion? Any more discussion on it?
I think we talked about that at our last meeting.
Yeah, I think we have, yes.
We talked about it, we just haven't made the official, and we did have one of the family members asking how we spent it, and that was just a good reminder to me that we need to make sure we handle this properly.
Okay. I would look for the motion and second have been made to approve it signify by saying aye.
Aye.
Opposed? Same sign, no. Okay, motion carried, so we'll move on to the financial report.
Got a few handouts for you.
Is that your phone?
Yeah, my son.
So, the first thing I'm handing out, and Sally, you should have received all this in email, is a few pages from the audit report as it pertains to the Human Services Department. I thought I'd start with the good news on the financial report. So this is from 2020, and the first page that you have there is basically, you see that second column called Human Services Special Revenue Fund. That's our Human Services Department. So last year, 2020, we had nearly 7.7 million in revenues and just under 7.1 million in expenditures. So we had a surplus. There was also some funds that were transferred into our department. That transfer in is when they do the budget each year, we, as individual departments, do not budget for any pay increases that might be provided through personnel bargaining, and then any health insurance adjustments. So that 165 that you see there, about 2/3 of the page down, that was given to us at the beginning of the year to cover those costs. So then, when you add that on to the 589 surplus that we had, that brings us to 756. We then moved about 100,000 of that over to the Senior Services Fund for the nutrition non-lapsing account that was set up a couple years ago. So at the end of 2020, that account is at 221,000, and there's no state requirements on it. It's how Trempealeau County chooses to spend it. So that was very forward-thinking in the group that set that up. And so in here, it's not showing, we transferred 600, I think it was about 600,000 to the general fund. So I wanted to point that out because that was really good news for us. A lot of that was unspent funds because we didn't go to training, we didn't have mileage, a variety of things that we didn't have referrals for child welfare for a while, so that's how we were able. And then we received a good amount of COVID money to help pay for senior services. We got about over $100,000 there. We got some additional funds. So that was a big piece of it. The second thing that you have in front of you is our, it's page 41 at the bottom. is, again, second you see about 2/3 of the page down, it says Human Services. These are our fund balance. So we have $15,452 in our Community Options Program. That's been there for a long time. We can use it as we need to for high-cost kids. There's another $972 that's set aside there. That's in a non-lapsing account, and that is when the, I'm going to get the name wrong, and I apologize, the Social Services Union closed out several years ago. That was what was in their account, and they agreed that it should be set aside. So when we have special needs for families, we could tap into that. Then on the next page, going down, we have that $31,857 for justice sanctions. That'll be going to county board next Monday. That will be moving over to the DA's office, so that'll be leaving us. Then we have another $6,781 for emergency direct services, and that is leftover general relief funds from back in the old general relief days. And what we've been using that for, up until Affordable Care came to be, was when individuals came to us and needed psychotropic meds and couldn't afford them. And if they didn't have them, they'd end up in hospital, being hospitalized. So we provided those to them until they got an MA. And if they got an MA, we might get some back payments to that. Now we're able to, again, with Affordable Care, we're able to do a better job of getting people on that. But that's what that is set aside for. And that little bit of money goes a long way, and that's not even 5 nights, about 4 nights at Winnebago. So that's money well spent. There's $1,500 left from our data system, so we can use it for the training or anything that we might need with the new data system that we're putting in. And then $49,000 for our vehicles. We did purchase 2 vehicles earlier this year. We sold a vehicle, so this will go down some. And then we still have our $500,000 in our contingency fund that's sitting there. So that's all good news. And then the last thing you have in front of you is the senior services on that sideways page there. And I hope I give you the right copy. Again, we had almost $800,000 worth of revenue, $618,000 in expense. We had some surplus. Again, transfer in, it was for the health insurance, and also that part of that is $100,000 that was transferred in for the senior services nutrition account that came from Fund 202. And so we ended up the year in we nearly doubled our fund balance in that area, but that sets us up in a really good place for future years. So we had a great year last year. Really pleased with how things turned out there. So just wanted to celebrate that.
That's great.
The financial report for this month, here you go. This is through July, but before we get into it, there is one new expense line on there called Healthcare Center 2020. And we wanted to bring this to you for your approval today. So this is that $18,696 that we've been in dispute with the healthcare center on. Rick talked with you several months ago. We had attorneys hired. The effort was to try to dismiss the case, and in lieu of dismissing the case, it was agreed upon by Rick and the Healthcare Center that it would go to the Exec Finance Committee, which it did last Tuesday. Healthcare Center gave their perspective. Human Services gave ours. We provided a number of pieces of documentation. Rick did not provide Rick Niemeyer did not do the presentation on Tuesday he needed to be neutral at that meeting. And they went into closed session and came out and made a motion to order Human Services to pay the Healthcare Center the $18,696. Erica is not able to, do you want to talk about all that? I'm not going to put words in your mouth. You say it.
Well, I just wanted to make a point that ethically, that is my bill to sign off on, and ethically, I can't do it. So obviously, I'm not saying the board can't choose to pay it.
but I am not comfortable, as I believe it was unethical and illegal, and that I would be risking my license by signing off on that bill.
So we don't want to put her in that position, so we wanted to bring it to you to make the motion, so we'd have it on record, and that would essentially be our approval to pay this bill, and technically do it that way. And I don't know if you have any questions or comments on that. Certainly disappointing from my perspective. We felt we had a good point of view on that, but it did not prevail at exec finance.
Do you have any information or feedback as to why they made that decision, or they just said, pay it and that's it?
That's all that was provided to me at open session. I did ask how they wanted to handle, because I think we all agree it isn't so much the money, it's the principle of it, and it's how people's rights are handled. And I asked the question about how are we going to handle cases in the future, and I was told very abruptly that you need to work together. And so I don't know what that means.
Excuse me, who told you that?
Mr. Zeglin, but I believe, that was clearly the people nodded, the other people in the room, so the other individuals from the exec finance committee concurred with that.
Is he chair?
Mr. Wallach is chair.
Oh, okay. So you don't know what the vote was? They
It was
just said
closed
this is-
session. Well, actually, it was unanimous, because they made the motion in open session
Oh.
to have Human Services pay, and it was unanimous. But I don't know what the discussion in closed session was.
Wow.
Everything that I heard about that meeting was that it had everything to do with optics and nothing to do with the integrity of an argument. It was just another headline they didn't want.
It was another what?
Headline that they did not want.
Well, it'll be in the paper this week, so.
Right. I think we have a board policy that states, and it was put into place long before this, which you guys followed, so,
That's still in place, and we'll continue to follow that. Again, if there's
We
a...
have policies for a reason, right. So I did let members of the exec finance committee that I talked to know that there's a policy in place, that the board wasn't appalled at what went down, and that our position remained firm and resolved, and so, yeah.
So, I forget how the logistics of working with them work, so I might need some refresher here. Do we have something like a contract in place? I feel like we do, that requires them to get services authorized before they provide them. I'm just,
The contract states what the policy is that, as do all of our purchase of services vendors, that will give you the rate in the contract, but the unit of services have to be authorized in writing in advance.
and we do have that with the
And that
healthcare
is in
center too.
that is in the language in the
Just wanna make
contract.
sure.
The argument that they said was they had this individual, they had to serve this individual, they had no choice. That was their argument in open session. Go ahead, Erica.
The argument was that they provided the service, therefore they should get paid, and we took a very long time finding an alternative placement, which we made counter arguments wasn't factual. But that's what, you can watch the open session and probably draw your own, well, was it recorded?
But
Okay,
it was
I guess
stated,
you can't.
it was stated in open session, it took us 3 weeks to find placement after the court case. That is false. It took us 72 hours or less.
Well, I think we'll just move on with
Yeah, I think
probably
the
a
decision's been
good
made.
lesson, and next time we will, I think it should be brought to their attention that Human Services should have a little more warning if they, at all possible, somebody should know, that this is, and get the okay, so that when we come to being billed, that we don't have a question.
That is a concern we have, is that this wasn't the first time this has occurred, and it won't be the last time. And there's only so much, that we can do to avoid. I'm just making that clear that
I don't think there was any lessons learned. And that's my concern moving forward, was that, you know, if people had come to the table and we had talked about the process, which we had done before, and agreed that, you know, was there confusion or whatever, but it was very, I guess that's not at all what was gleaned.
The next time it happens, I think a joint meeting with exec finance, as soon as it happens, to review the fact that we have a policy and put exec finance, the executive committee, on the spot. Do we follow policy or do we not? And then they can start to be part of that early on.
And wasn't it a unanimous decision that, from this board, that we would not support payment? I mean, I still.
At 3 meetings, 3 times
Right.
it was unanimous.
I mean-
I emphasize that as well.
Yeah,
And I also thought that we had settled that we were not responsible.
well,
I think too, bringing in as somebody from Disability Rights Wisconsin next time around to be part of it.
Yeah.
I'm absolutely on board with that, and I think that's what we should do, because we can't let them continue to do this.
At the end of the day, the individual's getting good care, and so we just am asking from this body the official approval to pay the bill so that we don't compromise Erica's social work license.
well, I can't agree with it for the same reason Erica does.
Oh.
Right.
Well,
but
can't exec finance write the check?
Yeah, exec
They're the
finance
ones
can
that
write the
decide to pay
check.
it. Let them pay it out of the general fund.
Good idea. Can we have a motion for that?
Yeah, I make a motion that exec finance pays for it out of the general fund. We said we weren't going to pay it. If they want to pay it, it comes out of their fund.
I'll second that motion.
The discussion there was if it came out of general fund, it would have to go to the full county board. And I think part of their decision-making was, again, to move past this, to avoid public perception of conflict within the county. And so, however, whatever your opinion is on that, I think that that's also something that should be in consideration.
My opinion is, I would say we move on, and we discussed the amount of money before, and that it wasn't so much the money as what it was the way it was handled.
Well,
And
for
I
me-
think we should move on to better things. We've had this now for a year or better, so that's my
But
opinion.
there's nothing more important than a citizen, a vulnerable person,
Right.
having their rights accepted, recognized. This is, everybody's so worried about how it looks, and they're worried about how it reads, and because this is going down the way it is, it will continue to happen. So it is a big deal, because what about the next person and the one after that? Put it to the full board. I want it to go to the full board. Let the story be told. If they're supportive of their argument, they can make it at the full board, in front of God and everyone. There's a motion on the floor. I call the question.
Right, and I agree with you, Sally. I think it's way more than about money. It's about the rights of an individual that receives services from the department, and to be treated as humanely and kindly as possible.
Well, you made the motion,
Call the question.
Sally made
Sally
the
made the-
motion and I seconded it.
and you seconded.
Yep.
So we'll call the question.
I call the question.
We'll look for the vote. All those in favor, or you want a roll call on this?
Roll call, because I have to
Yep.
abstain.
I'd say roll call. Dora?
Yes.
Karen?
Yes.
Diane?
Yes.
Michelle?
Abstain.
Jeannie,
Okay,
yes.
I understand.
Yeah, she's on that.
Jeannie?
Yes.
Sally?
Yes.
Okay. I'll go yes. Okay. Carried that we take it to the full board,
Go for, I mean, I think they,
exec finance.
take it back to exec finance.
Exec
Okay.
finance pays it, and however they have to do that.
So the financial report you have in front of you is, we'll have to make that one adjustment then, in that column where, we've got the $18,696 obligated there. Through July, that puts us at, if we had that in there, it would put us at a negative $836, which is about as close to the bottom line as you can get. This will put us back up into the black instead of in the red, so that's a good thing. We did, Erica and I will be bringing some additional information to you in the next couple months. Adult placements, adult crises have been exploding. People we haven't heard of before, between substance abuse and mental health problems and the stress and the prolonged stress of COVID, the isolation, the financial stress it's put on people has just caused a lot of problem for a lot of people. We just had another big bill again for in July for Winnebago, which is one of our few crisis places we could take people to, and it's $1,500 a night. And so what else can we do? How else can we serve people? What are the options out there? How do we budget for this? We are going to go over budget in behavioral health this year. There isn't any other way to say it. Typically, what we've been able to do in behavioral health is come in under, because we can use CCS and CSP and other services to get people stabilized, get them in the community, give them that support. But we're just having more and more people coming through, and people are needing long-term treatment in residential facilities, and it's getting pricey.
No, I think that's right. And just so you know, our CCS numbers and CSP numbers continue to increase. CSP pretty drastically this year, or dramatically, maybe I should say is a better word. And I feel like we're running our butts off trying to be creative and keeping people out of, because, we work really hard to keep people in the community. That's what we believe in. But we are just seeing a need for the residential placements. And then, of course, we've talked many times about the issues with not having enough hospital beds on this side of the state. We continue to flounder in that area. COVID has only made it worse because all the beds went to single beds. Pretty much the hospitals now will not take any difficult patients at all, or people that are really struggling. And so they all end up in Winnebago. And then we're seeing long-term stabilization needs. And it's killing us. So, and that you haven't seen the August bill yet, so that's another not good Winnebago bill, so.
So it's going to get worse before it gets better. So we just want you to know that that's out there. We're doing the best we can. We obviously can't say, well, we can't serve you because we have no money. I mean, that's not the business we're in, and so we have to keep moving forward. But we'll provide more on that. The other thing on financial report is that the Exec Finance Committee has created a committee to figure out what to do with the ARPA, American Rescue Plan Act funds. Mr. George Brandt is heading that up. I understand from him that he's going to be reaching out to committee chairs and asking the committees to provide some priorities to that group and what the work that they're doing. And so we'll add that as an agenda item for next month to talk about that as well. That's the financial report. Good news, bad news, and everything in between.
Okay. Move on to personnel.
Personnel report. We have several vacancies. Again, the Justice Unit will be reorganizing that. Oh, go ahead, Sally.
I'm sorry, I have to go.
All right, thank you. We still have a quorum, so thank you.
Okay, good. That's what I needed to know, is if you still had a quorum. Okay, I have a family situation, so I need to go. Thank you.
So for our personnel report, we have had a vacancy. We actually have 2 vacancies in Children and Families Unit. We've been advertising for that since July. We did interviews last week. We had 3 candidates. 2 of them dropped out before we even got to the interviews. We interviewed one, and she was really good. So we have a person. We interviewed for the billing specialist. We may have to reopen that position. That's still in the works. We're hoping to get that filled sooner than later. Again, with just 2 staff in the administrative area, that puts a lot of pressure on Sam and Mary, so we want to get that filled as soon as possible. Behavioral health services, we had a social worker position there. The deadline came and went. We had 1 application, and before we could even set up an interview for a 1 application, they turned us down. So we're struggling on social work positions. So again, if you have anybody you can send our way for children, families, or behavioral health, that'd be great. Economic support, we have a vacancy. The vacancy was created by one of our ES staff taking Chris Service's position in nutrition and transportation in the ADRC. So Ashley's loving that job. And those interviews are set up for this Friday. I believe we have 6 or 7 candidates we're looking at there. Fiscal manager, we have received just a few applications, but they look very good. And we are hoping next week, I believe, to set up interviews for that. And I think that covers all of our vacancies. Yep,
Anything
that's
else?
it. Nope, I had to think if there was anything else. That's it.
Okay. All right, and it is
5:25.
5:25, so at this time, we'll adjourn the meeting. And our next meeting date is October 11? Okay.
Thank you.
Thank you.
Thank you, everybody.
You guys are. Thank you. Is that a day? Is that a?